Dr. Cris here with the Ask Dr. Cris show. Today's question comes from Elizabeth. She's about to turn 40 and she's concerned because she hasn't had children, and everyone talks about an egg timer, and you're running out of time with fertility. And so I get that, I understand that. I have patients that come to me at that stage in their life where they feel that it's time to start a family and they're worried about the quality and about the quantity of their eggs. I would actually say that your overall health will determine your fertility to a greater degree. So your chronological age won't necessarily be your biological age. You can be still young on the inside, which is great news. If you've looked after yourself, reduced your stress levels, exercised, make sure factors like insulin resistance, which is weight around the middle, and fertility are obviously very linked. Polycystic ovaries, endometriosis, they're all conditions that we see generally on an everyday basis in clinical practice, and they can be tested and diagnosed. So keeping those conditions under control can maximise fertility. There is a test that you can do to see how many eggs you've got left. It's like an egg timer test. It's more accurate under the age of 35, but it can still provide some information closer to 40, and that's called AMH testing, anti-malarial hormone. If that level is low, you may consider going through IVF to have eggs stored until such time as you're ready to use them. So remember though that it only takes one egg to fall pregnant, and oftentimes the body will do what it does best, and it will select which eggs are best and it will use those first. So don't be frightened about fertility over the age of 40. Do speak to your local doctor about maximising your fertility chances and your health, and do speak to a gynecologist or an IVF specialist. If you're not yet ready to start a family, you're thinking that it might be quite a few years away, you may need to, in that case, store some eggs. So there's some great questions. Thank you so much for asking them. Please feel free to ask any questions below. I hope that you're loving the Ask Dr. Cris show. If you would like to see more of the Ask Dr. Cris show, please press subscribe.